Have you ever caught yourself or someone you know making repetitive movements or sounds without really meaning to? These sudden, uncontrollable actions are called tics, and they're more common than you might think. Today, we're diving into what tics are and exploring ways to manage them effectively. Hi, I'm Dr. Maridana, a youth, adult, and reproductive psychiatrist here to discuss all things mental health and wellness. Today, we're taking a closer look at tics, what they are and what causes them, and how you or your loved ones can help manage them. So understanding tics can be the first step to reducing their impact. So let's get started. So what exactly are tics? Tics are sudden, repetitive movements or sounds that people make involuntarily. They might involve eye blinking, shoulder shrugging, throat clearing, or vocal outbursts. They're classified into two main categories: motor tics, movements like eye blinking, grimacing, or shoulder shrugging, or vocal tics, sounds like grunting, throat clearing, or saying certain words unintentionally, such as cursing. Tics can be simple, short, repetitive actions, or complex, involving several movements or phrases. Common causes of tics. So tics are most commonly associated with Tourette syndrome, but they can also occur in other conditions or even appear temporarily in childhood. Stress, anxiety, or excitement can exacerbate tics. Interestingly, they can often lessen during calm, focused activities, but may worsen during heightened emotional states. Some medications or stimulants can sometimes increase tic frequency, and genetic factors often play a role, as tics can run in the family as well. So how can tics affect daily life? For those who experience tics, they can often be distracting, embarrassing, or even painful if they're intense. People with frequent tics may feel self-conscious, affecting their confidence or leading to social anxiety. Understanding that tics are often beyond the person's control is essential for creating a supportive environment. So what are some strategies for managing tics? 1. Behavioral therapy. CBIT, or Comprehensive Behavioral Intervention for Tics, is one of the most effective treatments for managing tics. It involves learning techniques to recognize tics early and engage in alternative actions to reduce the urge. Another one is habit reversal training. This is often part of CBIT and focuses on teaching individuals to replace the tic with less noticeable movement or behavior. Behavioral therapy is especially useful for children and teens, and it's helpful by helping them gain confidence and reduce tic frequency over time. Medications. In some cases, medications may be prescribed to help reduce tic frequency and intensity. Alpha-adrenergic agonists and antipsychotics are two medication classes that are typically used, especially if tics are severe or impacting quality of life. Medications are usually a last resort option after other therapies and is typically considered when tics are significantly disruptive to someone's life. As a psychiatrist, these tic disorders are something that I treat very frequently, and usually when the tics have become severe enough or debilitating enough that someone will want to treat them from a medication route. But this is always something that you should talk about with your medical provider. But it is also something that psychiatrists are used to treating on a regular basis. So if you are wanting to discuss medication treatment options with tics, don't hesitate to reach out to your child psychiatrist near you. Another way to help tics is by creating a supportive environment. Education for family and friends can be helpful of that. So educating loved ones about tics can help reduce negative reactions and creating a safe, understanding space. You can also help by building social support. Finding support groups or online communities can help people with tics feel less isolated and more support in managing their symptoms. Sometimes it feels nice to know that you are not alone in dealing with an issue, and sometimes people might be able to relate or share tips on what has helped them manage tics in the past. Mindfulness and stress management techniques. Practices like meditation, deep breathing, and yoga can help manage stress and anxiety, which can exacerbate tics. Mindfulness techniques are useful in identifying triggers and gaining more control over tic-related urges. Lifestyle changes. By reducing things like caffeine, improving sleep quality, and maintaining a regular balanced diet, these are all things that can contribute to lowering tic frequency. Physical activity can also be helpful in managing overall stress and supporting mental well-being. So when should you seek professional help when it's coming to tics? If tics are causing distress, impacting daily functioning, or worsening over time, consulting a mental health professional or psychiatrist or a doctor is recommended. Working with a therapist or psychiatrist can provide a more tailored approach and strategies with treatment options based on individual needs. So again, I'm a child psychiatrist and I'm very well equipped at managing and treating tics, both from a behavioral and a medication route. So if this is something that you have been struggling with, there's nothing wrong if, say, if you don't even want to take a medicine but want to explore the options out there to reach out for support. So thank you for joining me on how to learn about tics and how to manage them. If this information was helpful, please make sure to check out our additional videos on mental health topics such as autism and ADHD. They'll be linked below to continue learning more about mental health and wellness. And if there's a specific topic that you'd like covered, drop a comment below. I'd love to hear from you. Don't forget to like, subscribe, and click the notification bell so you won't miss out on our new content. Stay connected here for more insights on and support on your mental health journey. This is Dr. Donna.